This is deep dish, right?
Yeah, but let's get deep.
So I'm going deep on both sides.
Michelle, welcome to the platform. How you doing?
Doing great. Thanks so much for having me.
No, thank you for being here. Like I told you, like off camera, I don't think I've met anybody that has won so many awards.
Come on now.
So if you all are listening, make sure you all go to Michelle's bio on the Tennessee Justice Center website, and you'll just see the list. I think the whole bio is just Michelle Award, Michelle Award. Little couple sentences here, Michelle Award.
Because I'm old. That's why.
But now, just congratulations to you on just all of your success. And I think the most important part for me when I seen it is just like what you got the awards for, right? The work, right, that you put in for those awards. And so I just encourage everybody just go do a deep dive into all of that because it's amazing. I always love having Nashvillians on the show, right? We're unicorns, they say.
That's right.
That's what
It's
they
true.
say.
Yeah.
They say we're unicorns, so you know you're extra special guest. Just very quickly, like what are your thoughts, like just on Nashville today? Like what's your thoughts on it?
Well, we have a lot of work to do in Nashville, and it's exciting that we are able to keep bringing new folks into town who want to make our city and our state and our nation better. As somebody who is trying to recruit like the best and the brightest to do this justice work, it's neat that so many people now aren't like, "Well, I moved to Nashville." You know, we have the ability to get people to come here, but it's just there's a lot of work to do to make this a more equitable city, and it feels like we have a lot of work to do in terms of making sure that our legislature doesn't make it impossible for Nashville to be what it needs to be. You know, to be a hospitable, equitable, inclusive, vibrant city. And there's definitely not a shortage of work. Lots of people say, it's just too hard in Tennessee. Why don't you just go somewhere else and do this work? And it's like, I'm not giving these people my home. This is my home, and and if they want to do hateful things, they're going to have to do it over my dead body. So that's kind of been the reason why I do this work.
Yeah. Well, I want to talk about those two words, justice and equity, right? Because you co-founded and now the executive director of Tennessee Justice Center, right? And so before we get into that, like, what does that word justice mean to you? Like, what is it? How would you break that down?
Well, I think justice means that people are able to receive what they need to thrive in a democracy and then a Judeo-Christian nation where we say every single person is should be a cherished gift, treated as a cherished gift as opposed to mistreated and marginalized. And so, how do we give every single person what they deserve as a cherished person, and how do we give them a pathway to thrive?
Yeah. What was your inspiration behind like co-founding Tennessee Justice Center?
So the Congress, during 1995, Congress was going to restrict what civil legal services programs could do. They were very bothered by the fact that lawyers were representing poor people and they were winning. And so they were going to basically keep lawyers from doing a lot of things that they termed controversial. And so they were, there was a contract on America, Newt Gingrich's time, and lawyers from Tennessee said, they can do whatever they want to do, but in Tennessee, we're not going to have a two-tier justice system for civil legal services. There needs to be a place where you can go, even if somebody in Washington thinks this is controversial. There needs to be a place that's unrestricted. And so we were able to start Tennessee Justice Center to be that unrestricted place, to do things that real people needed, whether or not some politician found it to be controversial. And so I had been a year and a half out of law school. I had my own money, $17,000 a year, and I was like, I want to be able to do what families in this state need so that they can have their basic needs met, and stand with them, be their, Robin to their Batman, so that they can actually get the services they need to thrive. And So that, I mean, the lawyers across the state made it happen, and I was just excited to be able to be a part of it.
What were some of those like initial challenges and like, or even, you know, just barriers on like making that happen, especially fresh out of law school?
Yeah, well, there was no money, so
Number one barrier.
That's it. I mean, I had my $17,000 a year, and I had a laptop that I broke shortly after getting it from this grant, and so it was like down the middle, broken. But yeah, we didn't have anything else, and we just spent our own money to get started because we thought, well, maybe eventually we'll get money, and we did. We did get a little money, but the truth is, running a nonprofit is incredibly complicated and stressful, and what draws you into it is not all the stuff that you have to do in order to keep it afloat, and prioritizing what we're going to focus on when there's so much need and there's so many opportunities to move the needle for justice was challenging, but we were able to squeeze in our friend Richard Dinkins, who Judge Richard Dinkins now, he was part of the oldest civil rights firm in the state. He said when we were starting it, I know you don't have a place to go, why don't you go in my attic? It's not quite finished, but on 2nd Avenue. And anyway, we were able to have rent there and be inspired by him. It was also just lonely. We had been at Legal Aid where there was just vibrant numbers of people all the time, and then to be, with just the two of us was hard. But Richard Dinkins and his firm, they kind of took us under their wing and talked to us about how you do work that is changing systems, because it's not fast.
Right.
It's not fast.
Yeah. What does that look like as a white woman, right? Trying to change systems, understanding that, women in general have a different type of like barriers, and especially in a male-dominated field like being an attorney, or just life in general, right? But definitely in the legal field, right? Just male-dominated, white male-dominated. How did those experiences make you? What was some of those just typical days like while you're trying to build this as a white woman?
Yeah. Well, I mean, I guess first and foremost is like the legal kind of what you see on TV for fighting using the law is a lot of like aggressive in your face kind of fighting. And a lot of the kind of gifts that a lot of women have is more collaborative and problem solving, and building deeper relationships so that you can find common ground. And so, I mean, I found that to be helpful, because the truth is we can't sue to fix everything. So oftentimes what we find a solution is bringing the light out of people who don't really seem like they might have a light in them. But working with state officials to say, how can we make this better? Here's our clients' lived experiences. How can we solve this problem? And assuming the best about them. And we have the picture of Diane Nash on our wall all of these years, which I've heard her talk about. When she marched after Z. Alexander Luby's home was bombed, and she marched to the mayor and said, "Mr. Mayor, do you think segregation is right?" And what is cool about that picture, and what we gain inspiration from, is that she could very easily have given up on him and been bitter, and she just was like, he says it unnerved him that she was so open to the possibility that he still might know what is right and do what is right, and caused him to say yes. And I feel like we have to do that sometimes, and that that is obviously, I've been fortunate to work with men who also share those values, because we have a thimble full of resources and an ocean full of need, and so we have to be we can't just scream and yell in court, although we sometimes do. But we have to find ways to build common ground, and to move hearts and minds. Apart from what we do with changing the law, we have to make sure that people understand what it's like to be poor in this country, because generally people just don't know.
Yeah. What were some of those, I think, like things that you took away, especially like working on civil rights, and just legislation? What were some of those things that you maybe took away and learned that you maybe didn't know, or it just maybe hit you a little differently? Working on things like that, just being just a white person in general, but also trying to combat the things that white people have done to people of color, specifically black people in this country.
Right. Yeah. I mean, I think that that there's no question that my clients are marginalized at every juncture, not like back in history, but also just to this day, that people treat my clients as less than if they are black, and oftentimes if they're poor and white, and so there is this there is a mentality about the policies in our country, and really most profoundly in our state, that says it's okay to write certain people off. And I mean, I think that I lived a pretty privileged and kind of insular, middle class life, and I guess like took the teachings of my faith very seriously. Like, everybody matters, everybody is gonna, and if you say to somebody who's in power, like, you can't take this service away or this child will die, that they would say, oh, no, we don't want to kill anybody. And then again and again and again, it is right underneath the surface, this thing of there are people in this nation that don't matter to this day. And I guess we have to change that, and we have to confront our past, and we have to confront the present to just unpack that. Why is it that you think certain people don't matter? I mean, definitely racism, definitely classism, definitely greed. But how do we create a nation that we promise to be? How can we start to be all of the great promises that the Langston Hughes poem of "Let us be an America that we promise to be."
So what is your own kind of take on that? Like even currently, like where we are, especially in the state of Tennessee where we are, where like, what's the best way to phrase this? Like, where's your hope at, or where's your like kind of your meter on like we're moving forward, or things will be better, or like, even for me personally, I'm like, I want to believe it, like I really do. But time and time again, I feel like we make some symbolic steps maybe forward, but then when it comes like the policy and things, like I think we take lesser steps or just acknowledgement. And it seems like just the polarization of this country, like we're not seeing things the same way for whatever reason, even though like it's all right there. So I'm just curious, like where's your heart at, and your energy and your mind doing this for so long, just lived experience, like where do you feel we are?
So I'm an Enneagram 7. Do you know what Enneagram is?
I don't.
Well, basically it's basically is your hopes and fears are kind of the same. And what 7 is an eternal optimist. So like, I am always optimistic. I can always find the good in anything. Otherwise I probably wouldn't have done this work for almost 30 years, right? But we're in a really interesting time, because as you say, like we continue to be haunted by the legacy of racism, and by slavery, and by redlining, and by all the 400 years of things. And then we have a whole population of people who don't even know that history, who haven't even been taught the history. And instead of saying, like, how do we fix that they don't know, then the policymakers say, let's not let anybody know any history. And
let's ban it.
It's really breathtaking to me that having made lots of progress on getting people of every race and every political bent to stand with me on policy issues, what I find again and again is people in our state, our leaders don't reflect their values. They generally want things to be fair, and they generally want people not to have to suffer needlessly. That's just, I can talk to a room full of white Republicans, and I can get them to stand up and speak out on issues that we're working on, because they don't understand about the unfairness of it, and they don't understand about And so what's happening now though is nobody is reading the same news, and nobody believes, and it's hard to move hearts and minds when there's so much polarization and distrust, and when healthcare, frankly, healthcare has become such a polarizing issue. How did that become? I mean, it's like we all bleed. We all have parents who are sick or kids who have been sick, and it's like, how did that become such a divisive issue? So I guess my hope is that, because I'm a 7, my hope is that we just keep working together to connect people with each other, because when we post stories of our clients share their stories, and we highlight the details, the daily details of their life, people see themselves in clients, whether they're rural white folks, they're Memphis black folks. They see each other and they're like, that's wrong, that's wrong. And so how do we keep doing that when the whole rest of the world seems to be focused on fear and focused on, they're just so worried that somebody's going to get something that they don't have, right? I don't know. I feel like we're in a pickle.
I want to dive into some of that health piece, especially through just what you all do at Tennessee Justice Center. For people who may not know about or heard about Tennessee Justice Center, can you condensely unpack all the things that you all do?
So we do 3 things. We help individuals. So about 2,000 individuals called us last year. They were in every county in the state, and we help them navigate red tape so they can get health care and nutrition. And so if they are in debt in the General Sessions Court in Nashville, we can help them navigate that red tape. From those 2,000 folks, we try to see what are the system issues, and we work to fix system issues either through lobbying in the legislature, through educating people and pushing on national opportunities or threats, and then we have big court cases and small court cases. We do lots of trainings and partnering with other nonprofits because healthcare laws are so complex. And so we work with a lot of church health ministries, we work with clinics, work with food pantries, because frankly, the laws that are coming down the pike are often not reflective of their values, but they don't have time to be reading regulations. And so we try to make it really simple, get it to those folks. And so we partnered last year with about 1,000 nonprofits across the state. It's really amazing.
That is amazing.
Yeah, 1,000, and they I think kind of look to us to ask us questions if there's something really technical, but more than anything, they tell us what's happening in their world so that we can see what are the system issues that really need fixing.
Right. When you speak to like getting those Republicans and Democrats into a room and breaking these stories down, how do they not know about these? Isn't that like kind of their job to kind of know about these stories, know about these inequities that may be going on before they start putting any policy together?
I feel like that's what I learned in civics class, but that would be the first thing I should have said what I learned when I became the Tennessee Justice Center. I went to legislature and I'm like, this is not how it was in 6th grade civics class. Like, they don't have the information they need to make good laws because they don't know what it's like to be poor or even middle class in Tennessee, and they don't know how hard it is to just get through a week. And so one example is we have this kid from Chattanooga, star football player. He started having a lot of dizziness and nausea, and turned out he had a brain tumor. It was cancerous. They sent his mom was working 3 jobs, sent him here to Nashville to have the surgery done. He's on the gurney heading in to have the surgery, and they checked his health care and said he lost his health care. So they just came in and said to the mom, take him home, we're not doing the surgery.
Wow.
It feels like in the richest nation in the history of the world, in this era, that people just can't fathom that would happen.
Right.
Someone slipped her our number. We were able to get, because as often the case, she was eligible, but because the systems are built not for someone who has 3 jobs, which most of our clients do, and they don't pick how many hours they work whatever hours they get.
Right.
Her income was fluctuating, but he was eligible and he got the surgery. He's cancer free. But that's the thing. That most people, they just either they can't let themselves believe it, or they don't understand. There's this constant refrain of like, why are these people not pulling themselves up by their bootstraps? And in the case, of Trina and Darius, like, she was pulling herself up by not only her bootstraps but everybody else. She was doing all she could do. But the fact is, nobody can afford brain cancer treatment unless you have health coverage. And to keep health coverage, shouldn't require a lawyer. And yet
Right.
in Tennessee, when there's so much myths about who the people are who are trying to access this,
Right.
there's just more and more red tape and more hurdles to jump.
What are some of those myths like that you hear that you may come across that maybe our policymakers think that these are the people that is trying to access this and they don't need it?
Yeah, well, they're taking advantage of the system and they don't work. The vast majority of people who are on Medicaid and on food stamps, the vast majority of them work. And the ones who don't work often don't work because they live in communities that don't have very many jobs because many of their jobs left, like
Right.
rural hospitals. You know, we're number one in the nation at rural hospital closures because we
Wow.
failed to expand Medicaid. And when a rural hospital closes, it guts that community. And so you have folks who are getting by working at either at the hospital or at a small business by the hospital, and that hospital leaves, it just absolutely takes away a lot of jobs. And so if somebody's not working, you know,
Yeah.
and their family has been in that community for generations, it's not something that they can just up and get a job. Also, you know, so myths are, and this is actually not just with lawmakers. When our clients call us, almost all of them say, I'm not like those others. I'm not a deadbeat like those others, which is just heartbreaking because we
Yeah.
say, you know what, nobody is like those others. That
Right.
is something that's been pushed to you to divide you from the people
Right.
who are on your side.
Right. Yeah.
And to distract you from focusing on the people who are doing this to you.
Right.
And because they know if you were to join together with people who might not look like you, but all need
Facing the same.
facing
challenges.
the same targets, you would
Yeah.
have power. And honestly, you know, doing this 27 years and continuing to hear, I'm not like those others. It's
Yeah.
like, and to be able to step in the shoes of, the blessing of being a lawyer is you get to basically get in the shoes of somebody.
Yeah.
You get to hear all the things that make them who they are. And it's impossible to not be inspired and hopeful that these folks that I get to represent are in these communities all across the state, and they're amazing, and they are constantly generously giving to their neighbor and finding ways to make their community better. And yet the stories that are told about them, you know, and with racism just below the surface, and they don't ever say, you know,
Right.
because the vast majority of people who depend upon public programs in Tennessee are white people.
Right.
But they are constantly pushing this,
Narrative.
you know, this trope, which we've
Yeah.
been hearing for however many, decades and decades, and it's like, it's just not true.
Yeah.
But it gets them elected, and it gets them to win the primary.
What? So one of the other like kind of dynamics of some of this, just doing the work, is you hear these rural and urban, right? Like we're clashing, right? How do you see in your daily work our rural Tennessee and urban Tennessee kind of being very similar in trying to combat the same things, but maybe our misconceptions of each other keep us apart?
It's a really good question. I mean, essentially, in Tennessee, we're such a poor state that whether we're in urban communities or rural communities, it's the system isn't set up in order for people to thrive unless they have generational wealth. And disproportionately, black folks don't have any generational wealth, have very
Right.
limited generational wealth. And so we're all an accident or injury away from being, from really struggling. And
Yeah.
the people who get over that accident or injury are people whose parents have savings, or grandparents or great-grandparents have savings, because if something bad happens, which to most people, there's going to be a time in your life when something bad happens, it's like, who's going to be there to help you get through it?
Right.
And particularly with health issues, because there's just so incredibly expensive to be
Right.
to break something, or to be in a car accident, or to have a chronic illness. And so that's the thing that feels to me like rural versus urban folks. All of them are, you know, we were talking to 2,000 of them across the state, and they all have kind of the same story, which is they're just trying to get through the day,
Right.
and they're being hit with a tornado of red tape.
Right.
When they are sick, or when their loved one is sick, when they're most worried about losing a child or a parent, they have all this red tape, as opposed to compassion, as opposed to, you know, giving people a chance to get
Right.
what they need to not suffer needlessly.
Right. How do we alleviate that red tape? Because I hear that red tape when it comes to those that are unhoused. those as far as food security, health. It's like a lot of red tape to get help. A lot of it's like I have to be a lawyer to try to figure out, like, to navigate all of these things. Where if you know I'm unhoused, and which intersects with a lot of other things, right? They can cause me a lot of other complications in my life. Like, why are you making it so difficult for me to get housing? Or why are you making it so difficult for me to get health care if you know this is my situation, right? This doesn't make sense. How do we get around that? Or is systems intentionally built that way? Whether it's for profit or whether it's to minimize the amount of people that can take advantage of or benefit from these services. How do we finagle and pivot and combat that?
Yeah, I mean, it feels like it's vitally necessary that we do. I was just looking at some data around disparities. It used to be that there was a wide gap between life expectancy between black and white people in America, and there's still in some areas there's still a gap. But what has happened over the last 15 years is with the opioid crisis, with the ACA expanding coverage for lots of black folks. Basically, you have white and black people having pretty similar life expectancies. But if you compare Americans to other industrialized nations, European nations, they are absolutely running away with life expectancy. They're living so much longer than white or black Americans. And if you take the most privileged white American person and compare them to the poorest European person, that person is still living longer. And the reason for that is disparities. You know, this idea that we're so worried somebody's going to get something they don't deserve. Whereas in Europe, they figure out, what do we give people so that they can thrive? Childcare, you know, retirement. How do we enable people to thrive? And let's stop worrying that somebody's going to get something they don't deserve, because the truth is, fraud is something that is more about politics than about policy. You know, when you look at actual data about fraud, there's this sense, and again, I think that it has a little bit of racist roots of like, somebody's going to steal something that they don't deserve. And so we create this whole web of, you know, bureaucracy that makes it impossible for anybody to get what they need. And if you look at actual data around fraud, it's almost, you know, it's almost non-existent. People do not commit fraud to get a wheelchair. They, you know, they don't commit fraud so that they can feed their children. And if they do, well, shame on us. Like, shame on, let's create a system where people can have their basic needs met without constantly feeling like at any moment they're going to open their mailbox and they're going to fall through, you know, the looking glass. So I don't know how we do it, but I think it's the rest of the industrialized world, and I'm not just talking something, the rest of the industrialized world is leaving us behind on life expectancy. And if we don't figure out a way to set aside this thing that feels to me to be part like politics and part privileged people who don't understand that they were born on third base and criticizing people, you know, for only getting a second, like, then I mean, it's gonna be the end of the democracy, frankly. And it showed up with respect to the pandemic. You know, we have people dying who didn't need to die because they didn't have the support systems that most industrialized nations give them.
So this concept around health justice, health equity, right? Because I think that's what we're talking about, right? That's why I think we're talking about accomplishing health justice and health equity for everybody. Break that down to us. What does health equity and health justice mean?
Well, health equity means that regardless of where you were born, or what race or ethnicity you're born, that you have a chance to get the health care you need, to not suffer needlessly, and to live a full life. And we, in Tennessee right now, we're going in the wrong direction in maternal mortality and infant mortality. We're at the bottom of the nation in both of those two, infant mortality and maternal mortality. And as a white woman, if I were to have a baby, you know, it would be bad, but black women would be 3 times more likely to die than me. And babies, it's about double. You have about double the chance to die before your first birthday as a black baby than a white baby in Tennessee. And how can that be something that doesn't make people say, This isn't representing us. We have
Whoa.
to solve this. We have to solve this. If you care about mothers and babies, which we've heard a lot of people in the
Yeah.
office and elected officials saying they care about mothers and babies, how are they not rolling up their sleeves and solving this? Because this is not the weather. This is policy decisions made.
Right.
Policy decisions made hundreds of years ago. Policy decisions made, in the last little bit,
Yeah.
and we can solve it. We can ensure that babies make it to their first birthdays with their mothers.
Let's stay right there for a little bit, just because of recent Roe v. Wade, right? Mothers, families, and babies. Will you say that to policymakers at our state legislature? Why are they not rolling up their sleeves? Why does that not knock them back? Like, whoa, like how do we fix this?
Yeah, I mean, because I think they have this trope that is, we can't give people, the reason why mothers and babies are dying is because of bad decisions that they're making, because they don't really understand. They don't really understand what it's like to be poor. They don't really understand what it's like to be black in Tennessee. They don't really understand what it's like to be in pain and have your doctor not believe you. And so, I think there's an awful lot of learning to do, but also just an awful lot of how do we get elected officials in the legislature who are actually curious and compassionate? Because if they aren't those two things, we're going to continue to have policies. We're going to continue to lose ground. And we are one of just a handful of states. Now there's 11 states that haven't expanded Medicaid. And that we know that states that expanded Medicaid had massive improvements in health disparities, massive improvements in maternal mortality and infant mortality. And our elected officials, they won't even let us have a conversation about it.
Wow.
And they say, well, we think that Black Lives Matter. It's like, well, if you really do,
I don't know about that.
right? If you do, the way to show it real quick is to ensure that you are looking at the best information available around how to improve maternal mortality and infant mortality. And what we know from these other states is what improves that is not waiting until a woman gets pregnant to give them health coverage, because preconception care, meaning before they even get pregnant, giving them the health coverage they need, then is what gives you a better chance of having a healthy baby and the mom surviving the birth. And that's we don't have that in Tennessee. You can't get health coverage as a single woman mostly until you get pregnant. And then if you were sick or if you had some sort of underlying condition, you're out of luck. And we got to do better.
I want to make sure I hit on this, because when we talk about disparities a lot of time, or we talk about SNAP or WIC and a lot of things, a lot of times it's centered around black folks, poor folks. But what does that look like for Asians or for the Latinx community that live throughout Tennessee?
Right.
Are they facing similar disparities? I know we have this model, I'm saying it wrong, minority myth model, especially for Asians, that hey, they're okay, they're a perfect minority these type of tropes that goes along with them, so they often get left out of things or not represented or not talked about as much. So from your experience, from your just work throughout Tennessee, where do these other groups fit into this health justice and health equity kind of landscape?
Yeah, thank you for bringing that up. It's a really important point. I mean, essentially, Tennessee continues to face the consequences of being a white supremacist state. And so if you're a person of color of any, at all,
group,
you're gonna be disadvantaged.
Wow.
And you're gonna be disadvantaged both in terms of the healthcare system, but also in terms of all those social determinants of health. And those social determinants of health are things like, being in a good school, being housed, having a grocery store nearby, having a park to play in, all of those things that these other industrialized nations are focused on, and ensuring that every child has those so that they stay out of the healthcare system.
Yeah.
And so what is very sad is the policies for immigrant families. Many immigrant families cannot access a lot of public benefits, so they can't access TennCare. Unless they are here, a handful of them can, like Afghan refugees were able to access, through a little exception, they were able to access SNAP. But there's a 5-year bar. Even if folks are here with their papers legally, they can't access health care. And so that means the number of clients who called us, who come here, we had a client who came here to take care of her mother-in-law who was dying from another country. She got breast cancer. And she was too sick to get home.
Yeah.
And the healthcare system and the safety net, healthcare safety net, there's no way for her to get the healthcare that she needed. So immigrants are, based on policy, oftentimes excluded from appropriate health care. And, when you think about, like, who are the folks doing so much hard work to keep us, get moving, and they aren't able to have health care, it's just outrageous. If their children are born here, they're able to access care. If their children aren't born here, they aren't even able to access things like Department of Children's Services funding. I mean, they might be taken into the Department of Children's Services. We have the most outrageous story of a little boy who was born in another country, and he needed therapy because he had been abused. He was in the Department of Children's Services, and they had the child cleaning the therapist's office to pay for his therapy. Like, this is like some Charles Dickens stuff, right? Like,
right?
No, and no. So, immigrants are often very much disadvantaged, and the disparities that relate to them are very much, sometimes much worse, depending on what you're looking at.
Yeah.
And also, I think another piece that is complicated, and I'll unpack just briefly, is what we know that what helps with disparities oftentimes is community.
Right.
And so when you have a tight-knit community, as some immigrant communities very much have their community intact, and whereas redlining and public housing, many communities in the Black community have been separated, and so in some health disparities, that community makes a little bit of a difference, because you have women showing other women how to nurse. You have women showing other women, things that are helpful, and that happens in the Black community too. But I'm just saying there is some weird disparities that you can't quite understand unless you understand the many policies that separated Black communities, and that continue to separate Black communities from each other.
Yeah.
Especially across lines of class. That you have just incredible severe poverty together, as opposed to a more diverse class community.
I want to get your thoughts on this, because I just randomly seen this, and it was like perfect timing, because I knew I was having to have you on.
Yeah.
But maybe it would have been a city in Texas. I can't remember the exact city or state, but they was talking about SNAP, the Supplemental Nutrition Assistance Program. And they was talking about coming up with I forgot, you might have seen this. It was something they're trying, it was trying to put IDs on them. That's what it was. So it would prevent them from sharing or, using it to, like, hey, I give you this amount of money in cash if you for SNAP. What are your thoughts on that? And is that something that's about to start happening countrywide?
I haven't heard that, but I know there has been some sort of like hackers that stole people's SNAP benefits. I don't know if you've heard about the skimming, but they were hackers that were like taking people's SNAP benefits from them, because it is all electronic, and obviously, I think it seems like we're constantly in this mode of coming up with policies that aren't about making sure that there's food in people's mouth, and more about making sure that the state doesn't get cheated. And so I don't know which that falls into, but and I would know except for the skimming thing, which is recent, and that really left a lot of people without the food that they needed. And of course, the state's response to that wasn't as quick as you would have thought. You would have thought they would have just replaced the benefits quickly. Like if there's some sort of natural disaster, they're supposed to replace the food that people lost, but
Well, but I just thought that was interesting when I seen that story online. I was just scrolling. It was like, IDs on SNAP now, and it's like, again, it's like they're just trying to prevent people from getting food, and that kind of leads into like food, like security, right? For women, infants, families in general. And one program I have to ask you about is WIC, which is Women, Infant, and Children, right? Now, as a man, and this is for single women.
Yeah.
How does that apply for maybe single fathers? Would they be eligible for WIC, or is it a different program for men that's not WIC? Because how does that work?
You stumped me. I can't believe that. I will find that out and I'll get back to you. But I know that there's a little fun fact. We are the bottom of the nation, like dead last in WIC participation.
Okay.
Tennessee is the absolute worst at WIC participation. And that has to do with, again, the red tape.
Yeah.
And also just the stigma, which we haven't talked about. But there is this huge stigma about being poor in America that feels to me like, how do we get over that? Like, all of us need each other at some points in our life. And how do we get out of this mindset of people being ashamed to have to use SNAP or WIC or
So my mother and father were both had food stamps, right? The actual stamps growing up, right? And so I know from a black community perspective, it was, and I'd love to get your thoughts on this, and this would be a great dialogue. So my dad would tell me like, hey, like, this is not something like we was like kind of proud of because of what that meant like economically for your household if you had to have these stamps. So we'll use them, but it's like the goal was to like, not have to be on this. From my lens and my perspective now, I would say like people are like, hey, if I can get food stamps, like I will take the free food, the money monthly, whether it's $100 or $300, I will take it. Do you see that as maybe a challenge for the SNAP system where it's a generational thing, where generational families are just on SNAP generation after generation? Is that more red tape? Is that more of just like maybe like it's free money? Because if I make too much, I'm not eligible. So let me not make too much money, officially on my W-2, unless I won't get these benefits no more. Like, what is your thoughts on that?
I mean, I think the reason why we have SNAP is because we have a nation that's failing our people. Like, that we have jobs where people can work full-time, sometimes two-parent households, but full-time and still qualify for SNAP. And that's because we haven't changed the minimum wage for however many, 20, 30 years. That because we don't have affordable housing. We have let corporations create a system that makes it harder and harder to get by. And so, like, there's no shame if you are a victim of that system in taking what you need to feed your children. And what we found is we're one of the lowest participation of SNAP benefits for older Tennesseans. Part of that is the same thing that you're saying, which is there's so much shame. I should be able to, and maybe that's uniquely American, that I should be able to do it all myself. It's like, but you're a victim of corporations who took away your retirement and who made your tax, homeowner tax huge. And so it's like, if you are having to choose between medicine and meals, there's no shame in getting the food, because taxpayers pay for those SNAP, and you're paying taxes. All of us in Tennessee pay a disproportionate share of taxes because of the way that, regressive way in which things are taxed in our state around food and around every other thing. And so I think that feels like, how do we, this kind of, I felt like when the pandemic happened, everybody was going to be like, oh my gosh, like, one, we're so connected to each other, and our futures are all bound up with each other. And two, this system is really bad. It's really bad for regular folks. And if anybody, the number of people who have to live paycheck to paycheck and who don't have a safety net of, generational wealth.
One flat tire.
Right, and one broken arm.
Yeah.
And so it's like I thought for a minute there was like going to be clarity and everybody was going to say, we got to make this better. And then
Yeah.
it was like people started fighting about masks and vaccines and we just absolutely went the other
Yeah.
way. But yeah, I think the reason why people feel shame is
Yeah.
about a lot of it is an intentional messaging by the right that if you depend on a safety net, then you're less than.
Right.
And it's like, what about if you let corporations underpay people
Right.
or imprison people or I mean all the things that
Right.
they're focused on bathrooms and drag shows, and we continue to get poorer and poorer in this state because they don't do the hard work of governing.
And from my understanding, like the EBT card was a way to kind of allow people to have integrity, being able, because it looks like a debit card or whatever, and so it's like you're not going in with like a book of stamps, so it's not something where people can noticeably say, oh, he or she is on like food stamps, EBT.
Right.
Do you see it that way as well now, still currently having that, like giving people integrity, like this is like, yes, it's food stamps, it's EBT, but it's a little different because it's that debit card and it just looks normal?
I think people feel like, they can use it and not feel like people are looking at them. There was, this huge pandemic EBT, which came for every child in the state that had school lunch or breakfast. They got a card.
Okay.
And then that's kids who are in some parts of the state, middle class kids, and it was an amazing thing that like all of a sudden lots of people had cards who had never had cards before, and I think it destigmatized it for folks who who just feel like there's some things you can't buy with SNAP. Like there's all these things that's right below the surface that make it hard to be poor and make it hard in ways that I think our elected officials either know and don't care or don't know and aren't brave enough to fix.
Right. How do we end hunger in a state or even in a country, I would say, that is so wealthy, right? Or is it just capitalism that will continue to perpetuate and uphold these systems?
Yeah, I mean, it feels like it's solvable. It's not the weather. We can absolutely solve it. And the question just is, how do we call our elected officials out for not living the faith that they espouse?
Right.
And if we have children that are hungry and we have a governor who's about to shred, $60 million in pandemic EBT cards, which he did, I mean, we can't have that. If there's food available, if they say, well, we can't afford to feed everybody, well, let's explore that, because they are awash in money. They have gotten so much federal money over the last few years, and we continue to see that they're hoarding this money that's intended for poor families. I don't know why. But it's immoral, and we can solve hunger.
How does that work with grocery stores and restaurants that just throw away food, right?
Yeah.
Every day, right? There's even policy in places I know where, they won't allow them to just give away the food, right? Which is crazy.
Right.
How does that all intersect with health, justice, and equity when, like a Publix or a Kroger's literally just can't say, hey, this food is expiring in 2 or 3 days. We're not going to reshelf it. We're just going to throw it in the dumpster anyway, right?
Yeah.
Come get it.
Right. Well, and Second Harvest has done a lot of work around how to rescue food that is, going in the dumpster.
Right.
And I feel like we need more of that. We need more of people focusing on making sure that we don't waste stuff. And we need policies that aren't written by corporations that make food, and more policies made that ensure that there's no hungry people. We have an abundance of food in this nation, and the fact that people are going hungry is just a sin, and it's a sin that we were going to pay a debt for. My dad grew up in the Depression and very poor family, and when he went to go to the military, He wanted to ROTC scholarship, and they said he had scurvy, which is like, it's malnutrition. He was malnourished as a little person, and we pay the price of not feeding people in this nation, and it's embarrassing, right? It's embarrassing as the other industrialized nations just look at us and say, curiously, what are they thinking? What are they thinking? I mean, I do think capitalism has a role in people being hungry, and also it feels just like the irony of folks who proclaim a certain set of values because of their faith, and that they don't connect those things that they hear on Sunday to how they behave in the legislature or in their work. We can fix this, and we have to fix it, or we're going to be left behind by the rest of the world.
Yeah, it makes you wonder how they are connecting wholly and truly their faith-based beliefs in their, I guess, work ethics and values, and clearly they may not be aligned in all ways or sync maybe at all, but makes you wonder.
Makes you wonder, really and truly. But I say, I say we keep using what they say they believe to call them to account. Like where are the loaves and fishes?
Right. Right. Exactly.
Yeah.
Food security intersects with just a whole lot of other things, right? But another thing I want to talk about, I think is important, just because you kind of talked about Medicaid a little bit, TennCare, but I want to really go deeper inside of it and this block grant, right? And kind of what that means for Tennessee, and how many people are aware or aren't aware. Like, this is something that's looks like it's going to happen. It seems like.
So now it won't happen. Now we're hopeful it won't happen.
Okay.
So that's big news that has just happened recently, which is
perfect.
I mean, but essentially what happened is our governor was the only governor ever in the history of Medicaid, over 50-year program, to say Medicaid is a federal state partnership. So for every dollar that we put in, Tennessee dollar, the federal government gives us about $6.
Oh wow, okay.
And so a lot of the healthcare system is paid for by citizens of New York and California, and it is an amazing benefit economically for our state to have that much of a commitment from the federal government, for rural hospitals, for all of the facilities that we all benefit from because this investment of the federal dollars. But we were the first one that says, we don't want to have that commitment. We want you just give us all this money, and then we won't have this ongoing entitlement. We'll take the money and we'll manage it better. That's essentially what a block grant is you just leave the money on the stoop. Let's take away all these protections and just trust me. I'll take care of the money. I'll spend it on health care. That was asked for during the Trump presidency, like a year and a half later, after the insurrection. The Trump administration approved it, and it's the approval and the request was illegal. But the nature of Medicaid, which was approved by Congress over 50 years ago, is if we're going to pour all this money into a state, there has to be certain protections that say you're going to spend this money on health care for poor children and for older folks, because it's not a program that takes care of just poor people. You also have to be either a child or a pregnant woman, you have to be a senior or person with disabilities or a parent of young children. And I think that's a misperception that, like, as long as you're poor, you can access Medicaid. You have to both be poor and you have to fall into one of these categories. And so essentially our governor said, we don't, just give us all the money and don't ask any questions. We want flexibility. Flexibility is what we want. Well, but flexibility is that you have poor children going without care and you have no legal hook to say, hey, you took the money and you ran. Right. And so we brought suit. So the governor asked for it a year and a half before the Trump administration leaves. On the way out the door, they approve it. We filed suit with co-counsel in around the illegal nature of having this program protections go away.
Right.
And we have made some headway on that. I mean, basically, the Biden administration said no to a lot of the provisions of the block grant, including a pharmacy change that would have really taken medicine away from a lot of people with chronic illnesses and people with disabilities. They said, no, you can't do that. And there's still some that we are fighting about, but we haven't gotten to court because basically the Biden administration said they were going to open up comments and let people comment on it, and and they did that. We had about 1,000 people comment about what it would mean to them.
Yeah.
But if this had gone forward, it would have been the end of Medicaid as we know it. I don't know if you remember, but when Trump came in, the Congress immediately went to doing away with Medicaid entirely, making it a block grant across the nation, and that lost. It's kind of a miracle that it lost because they had the people who might have voted to do away with it, but and so this was the but next best thing was, let's start it in this way. Let's even get this state to do it, and then all the other states will line up because they don't want they don't want these protections. So anyway, we're still waiting for the court to get back to us on a couple of things. One is this retroactive coverage. If someone comes to the hospital and they apply, it takes them a while to get approved. They have to pay the bill until they're approved, and they waived retroactive coverage in Tennessee, not in other states. Most states you get 3 months that go back, so you can take care of those bills that come in as soon as you get there. And that's something we're still hoping the court will rule on, or the Biden administration will rule on, because they haven't decided about those provisions.
Okay.
Sorry, it's too long of a thing.
Oh, no. Like I said, you giving us a master class right now.
It's too much, too much.
I was like, but this is the stuff like that people need to know and be aware, because
That's right.
if they're aware, they can start doing
Use their own voice. Yeah.
Yeah, you can use their own voice, do the research, reach out to you, or
Get involved.
get involved. Yeah, get involved. Because you never know, somebody's mother, father, child, auntie. You just never know who may fall into one of these categories. Like, oh snap! Like we need assistance, we need help, and so that's why I think it's always good giving people like yourself to unpack these things.
Yeah.
So people can kind of get the full scope.
Yeah.
And not just kind of sound bites of it, right?
Yeah.
I want to get into children's health, and just the importance of what that means throughout our state, and what that looks like right now too for Tennesseans, and where we fall, I guess, compared to other states throughout the country, and our youth helps, and also what does that mean? What age level is children? Is that 1 to 18, or or 17, or what does that mean?
Well, so children's health is just vital to the future of our state, and the way that Medicaid defines children is 21 and below.
Okay.
And so that's really helpful, because the Medicaid Act has this great provision that says children should have what they need to reach their best, highest possible functional level, which that standard is what you would want for your own child, or for your own grandchild, or niece or nephew. And so that a lot of times private health insurance will say, well, we don't cover this or this or this. But what this program called Early Periodic Screening, Diagnosis, and Treatment is this incredibly rich benefit package that says, states, if you take federal Medicaid dollars, then you have to make sure that you're giving kids what their doctors say they need. You can't play a lot of silly games with the HMOs having the final say. And that actually came about because during the Korean War, they were trying to have an army, and there were so many sick people who were trying to sign up or were being drafted, and they said, we can't have that. We have to actually figure out a way to ensure that the next generation gets the health care they need. And so in Tennessee, we have benefited from the pandemic not cutting kids off of health coverage. So we have had a great improvement in the number of uninsured kids in our state. We have a lot less uninsured kids than we have had in a long time, and that seems like, well, big hairy deal. What does that matter? What it matters is we know from 30 years of research, if you give kids comprehensive health coverage, that they are more likely to do better in school. They're more likely to earn more as adults. They're more likely to go to college. They're less likely to have drinking or eating problems. We know that if you give kids comprehensive coverage, that the benefits we will feel for years to come. And it's kind of a no-brainer. How do we make sure that every single child who's eligible gets covered? Because the vast majority of children in our state are eligible for coverage, but the process is so complicated that many people think this kid isn't eligible. The only kids in our state who shouldn't be eligible for coverage shouldn't be because of the law, not because of morals, are immigrant children. Everybody else has a pathway to coverage, and that coverage has a really strong benefit, a strong promise that we can bring to life for those kids. So we have an Insure Our Kids campaign to make sure that we get the word out. If you know a kid who isn't covered, that's fixable, and we can help them get covered and benefit. Both they get dental care, they get mental health coverage. They get the services they need to reach their potential.
You had mentioned something. I took note of it because I wanted you to dive into this a little bit, if you could, about prison health equity, and what that looks like in our state in Tennessee.
Yeah.
Because I know a lot of people were released because of the pandemic, right? Because of COVID-19, where you say, "Oh, okay, he or she probably shouldn't really be here anyway, so let's go ahead and just release all these people who had non-violent disease."
Right.
Whatever, right? Where are we on the health equity or health justice for those that are in cage or in prison, and are their voices being heard, or is there work or power building around hearing their thoughts and their concerns, because those people are generally forgotten and say, hey, who cares? You did this, your health care, you gave all that up, right? Essentially you're the slave in a sense, right? You lost all your rights to be a human and be treated as a human being. And so what does that impact that for?
Yeah, well, there are two groups of people who the policies, Medicaid policies, exclude, and that is people in prison and immigrants. But what I think is interesting is if you, in states that have expanded Medicaid, honestly, when you pay your debt to society and you come out, in order to get back on your feet, you're going to need some health care.
Right.
And you're going to need some mental health care. And in states that have expanded Medicaid, their recidivism rates have vastly improved.
Right.
Why? Because they're giving people, when they get out of prison, a chance to get back on their feet in a way that's healthy and sustainable. Our state, we don't do that, and so we work with Project Return. Project Return, is doing their very best to get folks coming out of prison, back to the community, integrated in the community and contributing and being parents and being, being fully integrated back into the community. And they have to pay for every Band-Aid and everything that person needs, as opposed to providing health coverage, which every other state in the nation except for us and 10 others do, which seems just completely, we have so many elected officials who say they care about reforming, our, reentry. We believe that once people pay their debt that they should be able to come back. It's too expensive to have people, and it's like, well, if you really believe it, give them a chance after they've done their time to get back in, back to work or back to parenting, and you gotta give them a chance to get some health care, because the truth is, it's horrible. It's absolutely shameful what's happening to folks who are in prison in terms of the healthcare system. They're going without what they need. They're getting sicker, and they are, set of policies that just basically write off those folks. We have big corporations that we're paying, to provide health care to those folks, even though constitutionally they can't not meet their health care needs. They're meeting them at the bare minimum, what is needed for somebody who might have committed some really minor offense. And so people died in prison of COVID. We know that, and for really nonviolent minor offenses, because the healthcare system's broken.
Yeah. I kind of want to move to, as we kind of close to current.
Right now, in our state, the LGBTQ plus community is under attack, many would say, especially from our state legislator in many ways. How does the health equity, health justice affect their ability to get care in their, lived experience, or, whether it's queer, trans, lesbian, or just gay?
Yeah. I mean, I think that the fact that we've spent so much time and energy in the legislature around fear and hyperbole around trans folks and gay folks, it's just a shame. We have so many real issues, and particularly, making sure that people are able to access the healthcare, mental health care they need. And we know trans folks and LGBTQ plus folks are disproportionately likely to not have appropriate health care, whether that's because they don't have a provider that they can build rapport with, or because they don't have access to health care because, again, some of these folks fall into the coverage gap because we haven't expanded. If they're childless, they will be in the coverage gap in our state. But basically, it's like, how do you make sure that people have health coverage? Right. And then how do you make sure that the coverage actually works? And whether it works has to do with, are you going to cover the services that a doctor says they need? Right. Like at the Vanderbilt Clinic was saying these trans kids were worried they're going to kill themselves if they don't get the care, the gender-affirming care they need. And the legislature, not doctors, by and large, said, as opposed to like, let's just focus on what we know about science. Right. And let's not say, let's not trump science and doctors who know people in terms of making medical decisions. Right. And it just feels like just another example of they're creating policy all about their attack ads in their next primary, as opposed to hearing from real people. Mm-hmm. A friend of mine spoke at the legislature, asked his son about, basically the son being trans and this whole ban around gender affirming care, and listening to the daily details of that dad and that son's life. Like, how do you listen to that if you have a heart and not be moved by it? And of course, they just all sat there as if they would put their fingers in their ear and say, la, 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 la. It's like,
he's a human being.
They're human beings.
They may have a different lifestyle preference than you or I, just like we may have a different lifestyle preference than them or another person. But we all need health coverage, but regardless of how you identify. Period.
Yeah,
we all have bodies, limbs, and
yes.
organs and things that we need to tend to and care for. And so yeah.
And why do you care? And the expert said, the reason why we can't wait until these kids are adult is because of the suicide rate. And, it's like why do they put some sort of, I can't understand it. It actually it's just mystifying to me that they care so much about, I don't think they really care so much as they want to be reelected and they want to not be primaried on the right.
Right. And, there's one thing to have your own personal, right, internal beliefs, right? But I think you have to separate that when you're an elected official and say, okay, what is best for all people? Whether I agree with it or not, what is best for just human beings in general, of their whole health?
Right.
And it seems like I'm just getting into people's personal ideologies, and they're building policy around that.
Right. And not really understanding or listening to what is important to the people they're supposed to be representing.
Right. And I'm all for, disagreements, and we don't have to agree or believe the same thing. That's what makes life and culture, human beings unique and
interesting.
Yeah. Right. But at some point, when your ideas cause harm, or your thoughts and ideology cause harm to another person, right? And then I think you have to kind of stop and think about what that means.
We've lived through that. We've lived through that before.
Exactly.
Again and again. We can't learn the lesson. That's
exactly.
Yeah.
I want to close on this. This has been, I don't know, like this has been amazing for me.
Wonderful.
But I want to close on how do we achieve or get to a point where our state, we do achieve health equity. We do achieve health justice. What are some of the top things, 3 or 4 or 5, if it's 20, and what are those things that we need to achieve as a state, and how can everyday citizens participate in getting to that point?
Yeah, I mean, it feels like we need, like Dr. King's beloved community, we need a group of people who hang together, who push for a vision of our state that is so much better than it is. And it feels like in some ways that is, it's hard to do this work in our state because people feel like they're beating their head against the wall and they want to give up, So it's like, how do we get a group of people diverse enough and with different perspectives on solutions and on the problem so that we have a real fix, because obviously the way that Tennessee Justice Center has been around for so long is we just kind of we try to bring people together and then we just try to take a back seat and listen. And, and so how do we keep engaging people around health equity when there's lots of reason for despair? There's lots of reason for folks who are traumatized to be heartbroken. And how do we keep saying we can make a difference if we stand together? And so then what happens is we have to expand Medicaid. Number one, we have to expand Medicaid. We know if we expand Medicaid, we have less people dying preventable deaths. We have less cancer diagnosis. We have maternal and infant mortality going in the right direction, less recidivism. There is about 600 studies that show all the different health impacts of expanding Medicaid. And it's the number one health equity issue because what we've seen in these other states. Two, we got to focus on how do we create policy around centering Black and brown women in maternal and infant mortality, because if you can't have a baby without risking your life, then it just feels like we can't have that. So we have to figure out things like doulas, covering community health workers and doulas. Those things in other states are already, Medicaid programs are already paying for those, and they're making a difference, because what might be appropriate in white culture is not necessarily something that Black women want when they're having a baby, and it's not been working. So let's figure out what we can do, listening to mothers about what they want when they're going through pregnancy and labor, and then let's figure out how we can pay for that, as opposed to, I think the governor said part of his budget was lactation consultants. I'm sorry, I had 3 babies, not nurse home, but that is not what's going to solve these problems. We need to talk to the folks who, who have some answers, and in other states, we're solving these issues. You just got to be a little bit more curious about what the answers are. And now I'm just rambling, but
No. I wonder, we're here in Nashville, we're going to enter a mayoral election. We're a very mayor-heavy-led city. What does this mean for our local, here in Nashville, Middle Tennessee? What does that mean for our local officials when it comes to health equity, health justice, specifically for maybe our next mayor, wherever he may be, around some of these things that we talked about?
yeah, I think the challenge is that we have had mayors who we've had mayors who appreciated health equity a little bit more than our governors have. And whenever they stand up for something that is right, the legislature undoes it. And so it'll be interesting to see how, this is Music City, it houses more institutions of higher learning than most other city. And both musicians and students are people who generally aren't covered. And those are folks who, if we expanded Medicaid, would be covered. So it's like, I think the mayor is important, but I also think, how do we get a legislature that will let the mayor be the mayor? Because right now, it seems like every single thing the mayor does,
Or any city level thing, the state.
Whether it's Memphis or Nashville, they're vengeful, and they haven't focused on governing, but they're focusing on coming after Memphis and Nashville for governing. And so I'm worried about that. But obviously the mayor needs to understand what we have understood the Justice Center, which is General Hospital provides a service to folks who are uninsured, and it provides a service that nobody else will provide. And it isn't always perfect, but if you don't have access to health care, and that's true, as we talked about with the vast majority of the immigrant community, you need to have a public hospital that will be there for you.
Last words, Michelle. I always give the guests the last words. Anything you want to leave us with, and also tell people how to find the Tennessee Justice Center and get in contact with you. Add that definitely in, but any last words you want to leave us with?
Well, I'm just honored to be with you. Had a fun conversation.
Yeah, this has been a master class. I'm telling you.
You're so good. You're so good. Well, and we're just, the Justice Center, we're kind of a well-kept secret statewide group. So join us, because we have a lot of opportunity for regular folks to use their voice to make our state better, and to volunteer or to intern or to come work with us, because we're excited to be a part of this community, and we know we can't do it without other folks joining us.
I'm really interested. We're going to talk after this, but I want to let people know, I want to explore, Tennessee in these, different arenas, especially on the rural side, right? Because, we're from the city. It's a city country, right? From the city, that's right. But getting outside and actually hearing these, other folks from different communities and backgrounds, there's things that you hear, up close and personal, and what does that dog law look like and mean, right?
Right.
But also amplifying that in some type of way, so other Tennesseans can actually physically see and hear that,
Connect with each other.
Yeah. Because it's amazing that you and your team and others who this is what you all do are going out to these different counties. But I bet if that was everyday people could see that, oh, Michelle is oh snap, we have the same challenges. We're not too far apart as we may believe, right? I think that that would help optically. I think, especially for us here in Nashville, where we look around and it seems like our state, from my lens, it's like our state is doing great, because cranes are up everywhere in Nashville. But that's not the case, right? We just happen to be in the the economic hub of the state, right? And so we can, it might just be a little smoke screen for us. Because we can't see past Nashville. Right. It's hard to do. Yeah. And why wouldn't you?
Yeah, but building power. It feels like we have way more in common than divides us. And so that building power across the entire state feels like it's got to be the only thing that will save us.
The state organizing. The state power.
Which is necessary.
Exactly. Well, Michelle, thank you so much. This has been amazing. Again, a master class. Gems upon gems, and I'm pretty sure I only stumped you one time. We gotta figure out
on that.
Single man. What do we do? What do we get? We need something. But the only reason I brought that up because I'm a father too. I'm not single, but I'm a father. I always dang, okay, yeah, dang. Well, so for all the men out there, I asked the question. So Michelle's gonna come part 2. Michelle's gonna come back with the answer. But thank you, Michelle. Appreciate your time and just the work that you do. Flowers giving to you. But keep winning them awards.
All right. Thanks, Rome. Honored to be with you. See ya.